Being a young Filipino nurse, what's more fulfilling is seeing your hard work and being reciprocated by your bosses and your company that you work for. Like, for instance, what happened to me, I started as a regular nurse, worked up into a charge nurse, and becoming a unit manager all in 1 year. What I love about being a nurse, especially being a Filipino nurse, is how much the ability that we could make an impact on someone's life. Meaning a person that's dying, given their last few days meaningful and memorable, that the patient can thank you every day for all your efforts, and the family even thanking you. To this day, I have family still emailing me, texting me, or just checking in even way after family has passed away.
Yet fulfilling as a Filipino nurse is living up to what is be expected of a Filipino nurse. I've had several patients ask me, one of the first few things they say is, "Oh, are you Filipino?" And of course I answer, "Yes, I am." And to most of them, to all of them, they respond with a sigh of relief, or "I'm really glad that you are, because a lot of the Filipinos that have taken care of me or the patient prior have been very good." So we have a certain expectation to live up to that's been, passed down over many generations as nurses, a reputation that has built up to be very loving and caring, compassionate people as we take it into our profession as nurses, especially here in the United States.
I take care of patients in the post-operative period after cardiothoracic surgery, and their care demands incredible attention to detail, strong assessment skills, and the ability to communicate changes or recommendations effectively to the team. But this is exactly why I enjoy my specialty. It is incredibly satisfying to see patients move from a critically ill state to recovery, knowing you had a part in that process.
To a message to all the future nurses, I really wish that you went into this career for making a difference in someone's life and not for the monetary, because I'm going to leave it with this note. People will forget who you are, people will forget what you did, but people will never forget how you made them feel. And for us being Filipino, we always work hard, we always have that compassion, and we always want to make a difference. And that's what's great about our ethnicity, because those characteristics is innate, and that's what makes Filipino nurses stand out very well in the medical field. Thank you.
One thing I would like to advise nurses or future nurses or any Filipinos who want to become nurses is that it's definitely not something for everyone. They say it's easy, it definitely isn't easy, but if you are 110% into becoming a nurse, if you're passionate enough, if your drive is there, I say do it. It is one of the most fulfilling things to take care of a human life, to have someone on the brink of death and see them walk out the door days later. It brings the most joy to my heart. So that's it. Thank you very much. Take care.
Never, ever stop learning. By the nature of the nursing and healthcare in general, you should always be aware of current evidence-based practices relevant to your specialty. If you ever find yourself, quote-unquote, stuck in a rut, switch to a different specialty to broaden your horizons, or enroll in master's or doctorate level program. Once you have confidence in your practice, mentor others, and position yourself in other leadership roles. Filipino Americans make up a relatively large part of nurses, so we should strive to be trailblazers and experts in our profession. Thanks for tuning in with Makilala in Minutes. And don't forget to click to subscribe, follow, and like Makilala TV's YouTube channel to check out other